Diana, and I'm with Dr. John Chan from CVSKL. Welcome to our Q&A session. So, Dr. John Chan is our consultant cardiothoracic surgeon here at CVSKL. Hi, Doctor, how are you?
Okay, good, thank you.
Well, thank you for being with us today to answer a few questions. We have a few questions for you.
Sure.
Okay. So, Doctor, the first question that I think most of us would want to know, can you briefly tell us about your profession? What does a cardiothoracic surgeon do?
Okay, so cardiothoracic, so the cardio refers to the heart and the thoracic refers to the lung and the chest. So basically, I'm a surgeon who operates on the heart, lung and chest, that is this part of the body.
Okay, so we have few questions, and the first question is coronary artery disease is the leading cause of mortality in the country. So can you tell us what exactly is coronary artery disease and how is it treated?
Yeah, basically the heart is like any organ that has its own blood supply, and the blood vessels supplying the heart is called coronary arteries. So coronary artery disease refers to diseases of the coronary arteries. So these can form plaques or narrowings or blockages, and this will affect the function of the heart. So basically that is what coronary artery disease is.
So it's basically an open heart surgery.
Depending on the severity of the coronary disease. So most patients, when they have coronary disease, it's not so severe. So they have some mild narrowing of the coronary arteries, and that may give them some chest discomfort, chest pain, or they may get short of breath. So if the disease is not too severe, not too bad, then they can take medications to treat this condition. Now, in some patients, the disease is a bit worse if it causes significant blockages, and if it involves just one or two vessels, then stenting or putting a coronary stent to open up that vessel is the best treatment. Some patients have even more severe disease. They have blockages of several of the blood vessels or narrowings of several of the blood vessels. So when the disease is very severe, then a bypass surgery is the best option. So that basically involves creating new bridges to bypass all the old narrowings. So the heart, as you can see here, has blood vessels on the surface of the heart. So when there are a lot of blockages on the heart, what we can do is we can take a blood vessel from under the chest wall and some from either the leg or the arm to bypass these narrowings. It's essentially like building a new flyover or expressway to bypass the old roads. So the old roads are still there, but the blood has a new expressway to bring blood to the heart.
Interesting you put it that way. But what are the risks of doing a coronary artery bypass valve surgery, or also known as CABG? Is it better than angiography?
Yes. So the risk of routine bypass heart operation nowadays is about 1%. So that's the risk of not surviving the operation or having a stroke, bleeding, infection, or other organ dysfunction. So the success rate is about 99% in most patients. Comparing bypass surgery and stents, as I say, it depends on the severity of the disease. So bypass surgery would give you a better long-term outcome, long-term survival compared to stents if you have multi-vessel coronary artery disease, particularly if you're diabetic or if the heart function is poor. Of course, if you have just one or two narrowings, then stenting is the best option. But when there are a lot of narrowings in multiple vessels, then bypass surgery is the best option. In terms of the long-term outcome, and we're talking about living beyond 5, 10 to 20 years, that is where bypass surgery has the advantage. In the short term, of course, the recovery from bypass is a bit longer than stenting. If you go for stenting, you're out of hospital the next day. But bypass surgery, you're typically in hospital for about 1 week. After about a month, you're fairly okay, you can start driving again. But the full recovery takes up to 3 months for the bone to heal fully and for you to feel better than you feel before the operation. So it's the short-term risk versus the long-term benefits of having bypass surgery.
Oh, okay. So, okay. So just now, I think you mentioned about the valves. So there are valves in the heart. So can the valves get disease as well, or some sort affected?
Yes, the valve can certainly get disease. So if we go inside the heart, let's say we open the heart. The heart is a pump, so it has got valves inside, and this ensure that blood flows in one direction through the heart. So these valves here can get leaky or they can get narrow. So when that happens, the patient typically gets very short of breath because then the blood, which is supposed to be going in one direction through the heart, goes in two directions. So that puts some strain on the heart. So when that happens, we can repair the valve, which is the best option. If we can't repair the valve because it's still badly diseased, then we can replace it with an artificial valve.
So this one is considered as a major surgery.
That's right, yes.
So you do major surgery, and the surgery involves the aorta and the blood vessel coming out of the heart. So what conditions affect this?
Yes, so we've talked about conditions of the heart, the coronaries, the valves. There is this big red thing here. This is called the aorta. This is the main blood vessel where blood leaves the heart and the heart pumps. So this vessel can also get diseased by getting bigger, ballooning out, what we call an aneurysm. And if that happens, then we have to treat it to prevent it from tearing or rupturing. So we can replace this part of the aorta, essentially using a graft like this. So this is a graft where we can replace the aorta, and depending on the extent of the disease, we may or may not need to use this whole tube graft.
Okay, doctor, this next question is maybe my favorite question. So it says you can treat sweaty hands. I'm sure a lot of people love this question. So
yes.
Okay, first can you tell us why do people get sweaty hands and how do you treat it?
Yes. So we are talking not about a bit of sweaty hands. So we have patients where the hands are truly very sweating. So they will come into the clinic and the hands are dripping with sweat. And these patients will tell me it's troubling them to the extent that they can't write. So a lot of them, when they write a letter or they sign documents, the documents get wet. Students, when they take exams, it wets the exam paper. Some working with computers or their smartphones, they're unable to do it because it's just wet. So these are really not the typical sweaty hands, but the really very bad, badly diseased sweating hands. So it's a condition we call hyperhidrosis. And most of these patients would have tried various treatments like creams and taking medication. And it works in some patients, but in some patients it doesn't. So in those patients, we have an effective treatment where we can just cut the nerve. The nerve happens to travel at the back of the chest. So by using keyhole surgery, we can just divide that nerve and stop the sweating, and the hand becomes warm and dry. So that is one of the more minor operations we do. So we do big operations as on the heart, on the aorta, but we also do some minor surgery like this what we call sympathectomy.
So the patients come to you with sweaty hands. Are they young or old, or anybody can get this?
Typically, they are the younger patients. Typically, yes.
Oh, but good thing you can help them with this problem. Okay, doctor, so my next question is, are there any advances or treatment for the heart surgery?
Yeah, there are advances. So we are moving more to less and less invasive surgery. So if we're talking about we talked about the heart valve disease earlier. So rather than doing open surgery, we can do what we call percutaneous valve replacement. So we just make a small incision, usually in the groin, an artery in the groin, and we can push this compressed valve up to the aortic valve, and we can deploy this all through a small incision in the heart. So this is certainly possible. It has extended the range of patients we can treat, because typically these are patients who are not fit for the normal conventional valve surgery. So we can offer them this new transcatheter aortic valve implantation. It's still very new, so we do not know the long-term results with this type of valve. We know it's good for up to 5 years, but beyond that we don't know. So what we are doing is we're offering it to patients who are not fit for the conventional surgery. If the patient is fit enough to go through the normal surgery, that's still the preferred approach because we know the long-term outcomes of that. We know that it's good for the lifetime of the patient. But with this new procedure, we don't know what the long-term results are. But certainly for those who can't go for the conventional surgery because of risk factors, then this is one of the options we can offer.
Okay, doctor, so the last question, final question is that what is your advice to those who are opting or thinking to do CABG? What's your advice to them?
I think the advice, the best thing is to prevent the coronary disease in the first place. So we know all the risk factors like smoking, cholesterol, lack of exercise, and so on. So I think it's important for everyone to lead a healthy lifestyle to prevent coronary disease in the first place. But if the coronary disease is already there, everyone will need to take the medications for coronary disease. And then depending how severe the disease is, you may or may not need bypass surgery. But certainly if the disease is very bad, then bypass surgery will give you the best long-term survival. I think we have our current Prime Minister Tun Mahathir, who's 93, and I think we can safely say that bypass surgery, which he's had twice, has prolonged his life. So it's not not to say that it is a serious condition, but we have very effective treatment for this condition nowadays, to the extent that you can still live until a very old age and with a good quality of life.
Okay, Dr. John, thank you so much for answering all these questions. It has been very insightful and very useful, not just to me, but for the viewers out there.
Okay, it's a pleasure.
Thank you for watching, and I hope you like this video. So don't forget to follow and like us on our social media, and stay tuned for more videos like this. Thank you!